have pain, stiffness, and loss of function. And that's related to the commonest cause of the hip problem is hip arthritis, osteoarthritis, where there's a loss of articular cartilage. And that causes pain predominantly in the groin, radiating down the thigh to the knee and sometimes the shin. Pain can be in the buttock on the side of the hip. And patients also complain of stiffness. They have difficulty with putting their shoes and socks on, difficulty with getting in and out of the car. And they also report quite a loss of activities. Their enjoyment of activities such as walking, gardening, dancing, sports is all affected. And patients who have quite severe pain or severe limitation of activity for 4 months or more due to arthritis of the hip would then be considered for a hip replacement. Yes, there are different types of hip replacements. There are different types depending on the type of the way the components get fixed into the bone, cemented or uncemented. There's different types to do with the material, what the implants are made of, and particularly also what we call the bearing surfaces, or what components are rubbing against one another are made of. And there's different types depending on how much bone is removed. So in terms of the bone removal, a popular implant several years ago was a hip resurfacing, where the ball was partly removed and the implant didn't go down into the thigh bone. And that was very popular because it was very stable. The downside was because of the components being made of metal, you ended up with metal irons that were as secondary to wear would be left around the hip cavity. And in a number of patients, that would then cause adverse effects. And that has stopped a lot of surgeons from performing that type of surgery. And I've moved away. I don't perform that surgery. So a more traditional type of hip replacement, what I use a cemented stem, which is made of stainless steel. The cement gets its fixation in the thigh bone. And on the socket side, that could be either cemented or uncemented. The uncemented sockets rely on a coating contained on the implant itself, which allows bone to grow in. And then the bearing surface, or what's rubbing against the other, you could commonly use ceramic ball rubbing on a highly cross-linked polyethylene liner. And that's been shown to have very good wear characteristics and is very much accommodated and accepted by the body. Alternative bearing surface would be a metal rubbing on a plastic liner. And previously, we were using more ceramic rubbing on ceramic articulations or bearing surfaces, but they have also some side effects, things like squeaking. So there's benefits and downsides to all the different types of components. And my choice of component is very much discussed with the patient to depend on what would be most suitable for that patient to meet their needs of recovery, to have regain their activity after surgery. It's uncommon to have to revise a hip replacement once it's been inserted. On average, the hip replacements are lasting 25 years. And if you take within the first 10 years, between 3 and 5 out of 100 hip replacements will need to be revised or replaced. The reasons for replacing a hip replacement, the slightly more common one is that they can wear over time, and that can cause loosening of the components and pain. Other less common reasons for revising a hip replacement would be because of a deep infection, recurrent dislocations of the hip, following a fall causing a fracture and loosening of the components, and problems with painful hip replacements. Not very common to have a bowel problem after hip replacement. The first couple of weeks, patients can sometimes complain of constipation due to the pain relieving medications and the fact that they're not so mobile. Very rarely, patients can have something called an ileus, where the bowel just stops functioning, and then you need protective measures really to protect the bowel, to allow it to settle. Within a day or 2 days, it then recovers. And I don't see that very often, but that is something that can affect the bowel following major surgery. In terms of activities such as walking, and washing and dressing straight away. You can shower straight away after a hip replacement. In terms of getting back to doing more, say, activities such as gardening, or cycling, or swimming, about 6 weeks. Driving, 4 to 6 weeks. In terms of twisting sports like tennis or golf, or for patients who horse ride, about 3 months.